The next cancer that we're going to discuss about is breast cancer. It is the second deadliest cancer seen in women, and very important to know what breast cancer is and how it's spread and diagnosed. So breast cancer occurs when normal cells in the lobules, duct, or other breast tissue become damaged and grow out of control. The abnormal cells rapidly grow and accumulate, forming little masses called tumor. Depending on the location and what tissue it affects, it's given these names. These are the different types of breast cancer, and let's get into each one of them. Let's start with ductal carcinoma. These are primarily seen in one breast and usually treated with lumpectomy, radiation therapy, or mastectomy. Whereas lobular carcinoma is more bilaterally seen and more prevalent in premenopausal women. Invasive ductal carcinoma is the most common type and accounts for about 80%, and also seen most commonly in men. Invasive lobular carcinoma is the second most common type of breast cancer. It is a very slow growing tumor and it may not respond to chemotherapy because of its slow growth. Inflammatory breast cancer, however, is the most aggressive form of breast cancer. Here the breast will be swollen, red, and tender. It's very painful. It blocks the lymph vessels. They will be usually people with inflammatory breast cancer, they will be HER2 positive if they do blood tests, and they have a very low prognosis. The 5-year survival rate is around 40%, again, depending on the stage where the breast cancer was diagnosed at. What are the most common risk factors in breast cancer? The fact that if you're a female versus male, females have a higher risk of developing breast cancers, most commonly seen about 55 years old. If you have a family history of breast cancer, then you are at risk, about 2 to 3-fold increased risk to develop breast cancer later. The race, Caucasian and African American women are at much higher risk than Asians and Hispanic women. If you have a history of benign breast conditions such as benign fibroadenoma or other proliferative breast lesions, then you may have a denser breast tissue in mammogram and ultrasounds, thus giving you a higher risk of developing breast cancer later in life. If you have other types of cancer and if you are receiving treatments for chest radiation, or if you were a fetus that was exposed to DES when you were in utero, that also gives a higher risk of developing breast cancer later in your life. How can we prevent breast cancer? So mammogram is the primary preventative method and screening method in breast cancer. If you have a family history, then you may start 10 years prior to that, to the age that your family member was diagnosed with breast cancer. American Cancer Society recommends to start screening at 45 with yearly screenings, and above 55 you can switch to 2-year screenings. Other cancer preventative methods are doing a clinical breast exam, PCP, or a specialist will examine your breast for any lumps or bumps. You can also do a self breast exam at home. It is very important that you know and you're familiar with your breast tissue. You can make breast self-exam a habit, a routine habit that you can do in shower. It takes only very few minutes, and you will be the first person to notice a lump, a bump, a swelling, or even a difference in the way the tissue feels. You can easily put one of your hands above your forehead and just go in circular motions around the breast to feel for any lumps or bumps. You can also squeeze the nipple to see if you get any discharge or if there is any bleeding. That'll be a wrap for us. Together we can prevent. It is very important that we stay educated and be on top of learning so that we can prevent any cancers in our life. Thank you so much for your time. You guys have a blessed evening.